The topic of this video is dysmenorrhea. Adolescent females are the main group suffering from primary dysmenorrhea. With a prevalence rate of 56% to 93%, the discomfort caused by dysmenorrhea greatly affects the daily life and study status of female college students. Most of them choose painkillers but encounter many issues during actual use. We often hear questions like this. Will you eat for a long time from dependence? Will there be side effects when you eat painkillers every time you have dysmenorrhea? The painkillers I ate before are becoming more and more useless. Should I increase the dosage or use another type of painkiller? Before officially starting, we should say there are two kinds of dysmenorrhea. One is secondary dysmenorrhea caused by the primary disease, which needs to be treated by doctors in the hospital. The other is primary dysmenorrhea, which accounts for over 90% of dysmenorrhea. Most female college students experience this kind of dysmenorrhea. I have to say that patients with this type of dysmenorrhea do nothing but have pain. It's unreasonable. Before identifying an appropriate solution, we first need to discover the root cause of the problem. This requires root cause analysis. The root cause directly relates to how to solve dysmenorrhea. To facilitate everyone's understanding, I prepared some props for display. Whenever we come to menstruation, sometimes we will encounter an increase in menstruation in a short time, which can be discharged in the uterine cavity. At this time, there will be such dialogues in the body. Leader, my menstruation is getting more and more. It needs to go out quickly. Don't panic. Don't be afraid. I've already sent prostaglandins. Where do you need me? Where? Here, help me out quickly. Okay, that's enough. No, not enough. Let me help you again. I feel so painful. You see that many people's primary dysmenorrhea is produced in this way. Starting from this, we will find that the most direct solution is to solve the problem of excessive secretion of prostaglandins first. We all know some drug programs for treating dysmenorrhea, such as ibuprofen, acetaminophen, so on and so forth. Overall, these ingredients are often recommended to patients and they are also the first-line programs of various guidelines. Still, everyone also has concerns about these programs. For example, as mentioned earlier, some people will worry about the problem of dependence caused by long-term medication, thinking that all energy-seek drugs are dependent, but many people only take it for a few days when they have dysmenorrhea. I think it's difficult to regard it as a long-term medication with relatively less risk and no need to worry about drug resistance. But why do painkillers become more and more useless? First, the medication time may be wrong. Clinicians generally advise patients to eat it when menstruating, which can avoid excessive prostaglandin production later. Still, some people can't accept it but prefer to wait for pain before eating it. When the pain has peaked, ibuprofen is still in no hurry to play its role. After experiencing it once or twice, she doesn't believe this painkiller. Secondly, there is a medication plan. To relieve dysmenorrhea, we need to know when to eat and find a quick solution. For example, use several ingredients to cooperate to achieve rapid and effective results. For instance, in the scheme of acetaminophen plus isopropyldine plus caffeine, acetaminophen plays a core analgesic role. These three components gradually reach the peak of drug concentration in 15 to 30 minutes, which can not only satisfy rapid pain relief, but also improve the pain relief effect and reduce side effects. I want to provide more people with more suitable solutions, especially in the face of dysmenorrhea. Most women have to have 400 to 500 menstruations in their lifetime. In that case, I think not only girls with dysmenorrhea on the ELM central route should know about this, but people on the peripheral route should also pay attention to this. Because it has great significance for your family or partner, I also hope to share a quick and proper solution to relieve dysmenorrhea so that as many people as possible can spend their menstrual periods smoothly and improve their quality of life.